Right, thank you so much for staying with us. Time now for Her Say. And remember, like I said before, our conversation tonight is on caesarean sections, commonly known as C-section or CS, okay? And my guests are already with me in studio, like you can see. Minnie Murori, who is a mother and a digital marketer. Karibu sana, thank you for joining us tonight. And of course, Dr. Angela Anzeze, who is an obstetrician gynecologist and a member of the Kenya Obstetrical and Gynecological Society. Karibu sana, Doc. Thank you so much for joining us tonight.
Thanks for having us.
So, looks like we're going to start on a hostile note. Ask me why. Because, okay, of course, we put it out there that we're going to have this conversation tonight, and I did ask my viewers to engage with us on our social media handles. And listen to this comment by Like Kenya. He's obviously talking about CS, yeah, and he says it's not African. And it should be considered the last option for delivery. I mean, why? Why are we thinking like this, Doc, if I could start with you?
I would not say that's true. I don't think it should be considered as a last option. At the end of the day, as COGS, we want to ensure proper practice of reproductive health care and proper care of mothers, pregnant women, because pregnancy is a very high-risk state, and we need to ensure safe delivery of these women.
But when he says it's not African, I mean, does this project what some people think of us, women, of mothers? What is African? I mean, who said that this is how African women should deliver?
So, like the African culture, and what most people say is that, like the woman should undergo like pain. Like during childbirth, like to say that you're a strong woman, you're a strong African woman. So yeah, that's where that mentality comes from. Like people think that like natural childbirth, like going through that pain is like worth it.
The way to go.
Is the way to go.
Okay. Yes. Minnie, such comments, I'm curious about how they make you feel, particularly because you're here, because you've had CSs, right? Yeah. What do you make of this?
Sometimes I get very angry. Yeah, because it looks like us who went through CS, we didn't want to feel the pain, but that's a lie. Because when I look back, when I was giving birth to my first kid, I had a placenta previa and my baby was in breech. So of course, I couldn't give birth naturally. And when I think back, when I was giving birth to my second kid, she was still in breech, and I had the first car. So, of course, I couldn't still give birth naturally. Yeah, so I usually get angry whenever I find women discussing, like us, we are lazy, we don't want to feel the pain. It hurts me, kinda.
That is not the case.
Yes.
And Minnie, from what I'm getting, you clearly pretty much did not have a choice, you know, but to have a CS. But when you got pregnant, when you learned that you're pregnant, of course you're going to have this baby in 9 months, did you envision a CS or a natural birth? I mean, if you were to choose between the two, which one would you go for?
For my first baby, no. I didn't even think I was to get a CS.
A CS, yeah.
Because in our family, I'm the first one, and of course, it seems like I'm the last one. So I didn't think about me getting that cut. No, never.
The second one?
The second one, it was like almost automatic. I was to get the cut because I had the previous car. So automatically I was to get a CS. So I was waiting for it. Yeah.
All right. I shall come back to you to get to know more of your story because, of course, the discussion tonight is on aftercare, and that is where you come in, Minnie, but I shall come back to you. Doc, when I started the show tonight, I had some statistics from the World Health Organization, which pretty much say that more than 1 in 5 childbirths, that is 21%, are as a result of CSs, and this number is projected to increase by 2030. We should be at 29%, yeah? And WHO is talking about some unnecessary CSs, yeah? But before we get there to these unnecessary cesarean sections, let's talk about the numbers, and particularly in Kenya. Do we see cases of, you know, where a woman, a mother walks in and says, I want a CS, even though for not, you know, valid reasons?
Well, yes, we've been having such cases, and that is just simply because some patients are not cancelled, or probably they're cancelled well, but they just lack enough awareness regarding, deliveries and birth preparedness. So some women are do not opt to undergo a normal vaginal delivery because of fear of pain. Yeah.
And you've mentioned it, and it's here. Tocophobia. I hope that's the correct pronunciation.
Yes.
I didn't actually know there is like legit fear
Yeah.
of vaginal birth. Tocophobia.
Yes.
So it's actually a thing.
It's actually a thing. Most women actually fear that, like the vaginal area would, or rather the anatomy would like change or like expand in quotes. So there's that fear, and there's also the fear of the process of childbirth. So all that make women like come up with that, asking for a caesarean section. Yeah.
Right. So let's talk CS now. And for someone who probably doesn't know, what does it involve and how long does it take? I mean, some people would think that that process of delivery takes shorter for CS than normal. I don't know. You tell us.
So a caesarean section is delivery of a baby. It could be by emergency or planned by surgery. And a cut is made on the abdomen and the uterus, and the baby is delivered through the cut that's made, and that's followed by the placenta. And all those places that were cut are now closed in layers. Yes. So that's what a CS entails, and it takes about 1 hour on average. It depends, that's like the average time. It may be shorter, it may be longer, and not all, some caesarean sections may have certain complications, and that makes, the process maybe slightly longer than the average CS.
What complications?
So, like, for example, if it's a previous caesarean section, previous caesarean sections have, higher rates of complications. Like, for example, placental complications. The placenta may not be well placed or may undergo difficult delivery, or even bleeding. Bleeding is the most common complication of a caesarean section, and that can take the process longer than a normal, straightforward caesarean section.
All right.
Yeah.
Now, Minnie, I want to take you to your first CS before we talk about the second one. And clearly yours was an emergency situation. It was not planned, yeah? So when you were told, I assume you were told, I want you to take us through that, how you were told, how you received this news that it's going to be a CS, how your family received it, because you were telling us you were the first and probably the last. Take us through that.
I didn't think I could have a CS. So I made one mistake. When I was doing my antenatal care, I was going to a different hospital, and I decided to give birth in a different hospital. So they didn't have any data about my pregnancy, about like everything. So I labored, yes. I labored for more than 24 hours. I don't know why they didn't do an ultrasound, but I labored. So the following day in the morning, they were like, no, you can't give birth now. And I was like, I want this baby out. I was even tired. I was begging them to take the baby out. So I'm not quite sure how it took it, because I was like begging. And the funniest thing, my family didn't know about it. They came to hear that I gave birth through CS, because it was very fast. Yes, it wasn't planned in any way. Yeah.
And if we could skip and go to the healing part of this first one, yeah. Let's not get to the second pregnancy yet, yeah. So how was it after, that healing beat, and how 6 weeks, doc? That's what it should take to heal. But what was your experience like?
It was very easy. I remember that morning after my C-section, I was sitting down. A few hours I was walking around. It was very, very easy. I can't compare it to the second one. The second one, I was almost bedridden. I couldn't even turn in my bed. I couldn't sit up without support. The the two scenarios were very different, and I was like not expecting that. I thought the second one will be as easy as the first one.
All right, now that you brought it up, let's talk about it, okay? We shall engage Doc on the intricacies of it. But what was, you have mentioned it, yeah, your experience with the second one, but what are some of these complications that arose?
I was feeling a lot of pain. Because I remember the day I was discharged, I cried, I wailed. You know, I wasn't sure why the doctor was letting me go with all the pain. I remember the first day after I arrived home with the baby, I didn't breastfeed her. The pain was too much.
Yeah.
You know, I couldn't sit down, and the most unfair thing, both my nipples were cracked. You know, I was in so much pain. I didn't breastfeed her. I left the baby with my husband to sort her out. Yeah. It was, I can't imagine, the pain was too much. Yeah.
All right, I shall come back to you. Doc, what can go wrong in a CS, which you mentioned, the procedure itself, but in the healing process too?
So complications of caesarean section include infection. First, even before infection, I mentioned bleeding. Bleeding can be very heavy, and that's what you call postpartum hemorrhage. And in the event that it's very heavy, the patient ends up, you know, undergoing certain procedures, having certain medications, and having a prolonged stay, depending on how severe it is. So that prolonged stay, and as a result of that whole process, puts the body under stress. So this predisposes the mother to, you know, infection. Infection on the wound, infection that spreads even to the inside of the organs that surrounds the uterus and all that. And that may also predispose her to undergoing a second surgery to clear the infection, because it forms pus. And yeah, so the pus needs to be cleared, drained, and she's put under medication again. And this may also predispose her to even being admitted into maybe ICU, depending on how severe it is. Yeah, so it can go to such an extreme. Yeah.
Wow, I feel like I want to ask, what should be done to prevent that? Is there anything that can be done?
Yeah, so normally we give antibiotics as per the local guidelines and as what we as COGS recommend. We give antibiotics prophylactically when the procedure is starting, and also throughout her stay in hospital. And we also counsel the mother, even while we're seeing her antenatally, before we admit her for cesarean section, we tell her, look, you're about to undergo a CS. This is the procedure, what it entails, and the possible complications and the possible risks. So by the time she's going to hospital, at least she has like knowledge about it. And we also explain like what to do after the surgery, you know, proper wound care, hygiene issues, take your medication as you're supposed to. Don't stop, complete your dose of antibiotics, you know, don't stop taking your antibiotics prematurely, because you know, it can predispose to infection. And we give creams and, you know, wound care products to take care of the wound. Yes.
Right, and Minnie, of course, no blame game here, but what Doc is talking about, did you experience it? Did you have, you know, the medics at the hospital you are in explain to you that probably this is what is going to happen, this is what you should do? Because you actually did say that when they were discharging you, felt like, or you asked why they're doing it when you're in so much pain.
So unfortunately they didn't. And unfortunately my CS wound opened after 2 weeks. I had to go back to the hospital for more 3 weeks for treatment. Yeah.
So when all this is happening, what is happening to you emotionally, psychologically? Because I can imagine this is not just physical, it's beyond physical.
I was, I'd say I was very, very broken and frustrated at the same time, because I didn't like imagine this could happen to me. And the worst thing, the CS wound was even smelling. I don't know why. So when I went back to the hospital, they were dressing the wound like daily to see if it closes. And I was very lucky I didn't go back to the theater to be stitched again. Yeah.
Doc, should that really happen?
Well, it's also one of the complications. Infection is another common complication after postpartum hemorrhage. So it may happen.
All right, okay, okay. Let's switch gears now and speak to something that should have been at the beginning, because our viewers would want to know when a CS is essential, when it's really, really necessary to have a CS.
Okay, so those are the indications of a cesarean section. It may be an emergency or it may be planned. An emergency occurs whereby maybe the status of the mother is at risk. For example, if she has very high blood pressures or she's convulsing as a result of those high blood pressures. So her life is at risk at that point and the baby's life is at risk at that point. So we need to initiate delivery as soon as possible. So the purpose of a CS in emergency situations is to deliver the baby as soon as possible to prevent further complications of the baby. Another example is maybe the baby may be too big for the baby to pass through, through the pelvis, through the birth canal, or in some situations the baby may not be positioned well. Yeah, so we need the baby's head to be facing down, but if it's the other way around, which is called breech, that you need to deliver via cesarean section. Placental issues are another common thing, especially in mothers who've had previous cesarean sections. So they're likely to have placental issues. Maybe their location may not be the correct position. It may be blocking the way out of the baby, like if it's low lying, or if you've heard of placenta previa. Or if it's even abnormally attached to the uterus, like if you've undergone multiple CSs, in some cases the placenta may attach abnormally to the uterus, and it can even go beyond the uterus to the surrounding organs, and that's called placenta accreta, like it's abnormally attached. It can even go through and through all the layers of the uterus to the surrounding organs like the bladder. So in such situations, it's not advisable to deliver normally. So we advise the mother to undergo a cesarean section. Another thing, another indication is fetal distress. I don't know if you've heard about that, or you've had mothers say like, my baby got tired. So that's fetal distress. That occurs when the baby's status in the womb is now at risk because the blood supply of the baby is maybe compromised. And when the blood supply is compromised, now the baby starts to get distressed, or in layman terms, tired, and passes stool in the womb, and that's called fetal distress. And they pass meconium. Meconium is now like that stool they pass. So whenever you see like that greenish color of amniotic fluid liquor, and that's an indication that tells you like this baby is not doing well and we need to do something to deliver as fast as possible.
All right, so that is emergency.
That is emergency.
CS, and there is planned CS.
Yes. So planned CS is when maybe during antenatal care, and that's why we emphasize the importance of antenatal care. You do ultrasounds to check, is the size of the baby okay? Is the baby's position okay? Is the placenta located in the right place? So once we do antenatal ultrasounds, we are able to now plan the delivery earlier. And now when we see those abnormalities, now we tell you we need to plan your cesarean section. Another indication is if you've had multiple cesarean sections. So like, for example, two cesarean sections or one cesarean section. And maybe that one cesarean section depends on why the previous cesarean section was performed. So like if it's a two cesarean sections, we say you cannot try a normal delivery. But if it's a one previous cesarean section, it depends. We don't always say like, because you've had a one previous cesarean section, like it's not possible to deliver normally. It's possible, but it depends on why the previous CS was done, and it depends on the current status of the pregnancy. Will it allow a normal delivery? Things like weight of the baby, and how long ago was the previous cesarean section done. So if it's something like a year or less, then we say that may be a bit risky to undergo a normal delivery because of risk of the scar giving way, or we call it rupture, risk of uterine rupture. So things like that. Those are now the indications of how we plan cesarean section.
Right. And you know, Doc, you're taking me back to the comment I read earlier from Lycum, Kenya. I don't think I'm going to forget it. Because I'm imagining a situation or a scenario where you have a rigid woman or that woman has a rigid spouse. And they are insisting that we must give birth the natural way. Yet all indications are that a CS is necessary. What do you do at that point as a midday?
So as a medical practitioner, you have to counsel the mother. In our career, we do counseling a lot. We tell you even during your antenatal care, even when you're in that labor ward, we counsel you on why we're doing what we're doing. So if her life is at risk and the baby's life is at risk, and we say, look, you can't deliver normally and you need to undergo a cesarean section, and despite all that effort and in making her understand, like, this is the way we need to go, if she declines, there's something called consent. Consent is ensuring your patient understands why, what procedure you're about to do and why you're doing it, or what medication you're giving and why you're giving it. So we normally take consent before any surgical procedure. So if she declines, consent, if she says, no, I'm not doing it, and she signs it, and, clearly it's indicated in that consent, like she's declined, there's nothing really you can do. Yeah, you've counseled her and she's declined. You cannot force.
Right.
Yeah.
Right.
Yeah. So.
Okay. Okay. And Doc, when you were talking about an emergency CS and the factors that lead to it, you mentioned when the baby is too big to pass through the birth canal. Yeah. So I am imagining a situation where it's twins, it's triplets, it's quadruplets. Is that a factor?
Yes, that's a factor. It's a good question. So twin delivery, it also depends. Triplets, that's a definite cesarean section. There's no negotiation. Twin delivery, it depends. You can have twins that share, that have their own, like, amniotic sac, like their own amniotic sac and their own placenta, like they're separate, like in their own separate, like, compartments. And in that case, if the first twin, for example, the head is now down, facing down, like ready to be delivered, that we can allow a normal delivery, because the first twin will be delivered and the second twin can somehow be maneuvered and turn into the right position and be delivered. But in the event that the twins maybe share a placenta, then we recommend a cesarean section. Yeah, if they share a placenta and their own amniotic sac, definitely a cesarean section. Yeah, so triplets, anything above that, for sure, that's a cesarean section. Yeah.
All right. Now, again, I take you back to something I said at the beginning when I was talking about the statistics, and I mentioned WHO talking about some unnecessary CSs, and I tried to read your what's it called? Verbal, what's it called? There's a word for it. Your face and
body language.
Body language. How can I forget that? Your body language. I tried to read that because there was some reaction to Doc.
Yeah.
I mean, unnecessary CSs.
I can't say. I mean, we don't. There's no unnecessary CS.
There's no
unnecessary CS. We have, as COGS, we have local guidelines. We also have international guidelines on why the indications of cesarean sections. And if you're undergoing antenatal care and your doctor feels like they're not comfortable with you having a normal delivery, then they usually recommend a cesarean section. Maternal request, by the way, is also an indication. Yeah. If you say, like, if you tell me as your patient, like, you don't want to undergo normal delivery, I will respect that. That's a maternal request, and I will indicate in the consent form that you requested for a cesarean section. Yeah.
So there is no unnecessary CS.
There is no unnecessary CS.
All right,
Yeah.
Minnie, let me come back to you. I feel like I've kept you out in the cold for a while now. I want to know about looking back right now. You know, it's been 2 CSAs, yeah? And I remember asking whether you had a conversation with your medic, what Dr. Angela here is talking about. Looking back, what do you wish you knew about ACS?
I wish I knew how I could take care of the wound, because I think I failed on that. Because it opening up, I think I just failed, because I was walking around, I was doing my chores as usual. I think I just failed, because I was still feeling strong, so I wasn't, I didn't want to rest much. Yeah.
All right, you talked about your first CS and you're already walking that very day.
Yeah,
the first CS.
Yes.
Yeah,
but I was very young. I was very young. I think age was still a factor.
Wow.
Yeah, I was 20. I think I was 23. Yeah, I was very young.
But you're strong. I mean, you have to take that. You're a strong woman.
But when I compare the second one and the first one, you know, they are very different.
Yeah, heaven and earth.
And I wanted to ask Doc,
Sure.
why was I feeling so much pain after the second one? You know, I wasn't sure if they didn't give me the right medication for the pain. Up to now, I'm not sure what really happened.
Well, you also mentioned you had a previous cesarean section. Now, when you have any surgery, your body is not the same again, because you have cuts, you bleed, and there's a process of healing that's going on. And what does healing do? It forms scars. So maybe there may have been a lot of scar formation, which we call adhesions. And when you have adhesions inside your abdomen, that can make the surgery a bit more difficult. Like the second surgery, it can make it a bit more difficult. And that can lead to predisposed to now complications in the recovery time. Yeah.
Right, okay. And I like that. Thank you, Minnie, for posing that question to Dr.
And I think I have several. At least I have the chance now to answer them.
Yeah, and please do, by the way, because you know what, you're also asking for someone who's watching. There are probably some questions that I won't ask. So if you have any, feel free to speak.
I think I'll spread them out.
Please do. Okay, okay. All right, but Nick tells me we need to take a short break here on TV47 Weekend Edition, hashtag #Say. What, Nick? Oh yeah, you can actually send in your questions via WhatsApp. That number there on the lower thirds below your screen, okay? Send in your questions and Dr. Angela shall be gracious enough to respond to all of them.
On Instagram, Dr.Anzeze, on Instagram, Facebook.
Most definitely, okay.
Yes.
So let's take that break. Don't go anywhere. Stay with us. We come back with this informative and insightful conversation on cesarean sections. Stay with us.